Welcome to UMCC Medical Consultant Connector, where your health matters to us. Today, we delve deep into the world of Digitalis glycosides. UMCC serves as a bridge connecting you to the world of medicine, simplifying complex health topics. Now, on to Digitalis glycosides, a group of drugs that can do wonders for the heart. They're derived from the foxglove plant and have been used in medicine for centuries. Now that we've set the stage, let's dive into the specifics of these fascinating drugs. First, we'll explore the pharmacokinetics of Digitalis glycosides. This is how the body affects a drug. Digitalis glycosides are absorbed primarily in the stomach and upper part of the small intestine. Once absorbed, they're distributed throughout the body with a particular affinity for cardiac tissue. This is where they exert their therapeutic effects. In the liver, Digitalis glycosides are metabolized by enzymes. Metabolism transforms these drugs into inactive compounds, ready for excretion. These inactive compounds are then primarily excreted through the kidneys. It's important to note that renal function can significantly influence the rate of excretion and, consequently, the drug's half-life in the body. In some cases, Digitalis glycosides can also be excreted unchanged in the urine. This complex process of absorption, distribution, metabolism, and excretion defines the pharmacokinetics of Digitalis glycosides. Understanding the pharmacokinetics of Digitalis glycosides provides us with the foundation to understand their effects on the body. Now that we've understood how the body processes these drugs, let's focus on how they act on the body, the pharmacodynamics. Digitalis glycosides, at their core, are all about balance. They work by inhibiting an enzyme called sodium-potassium ATPase. This inhibition increases the intracellular sodium level, which in turn increases the calcium level within the cell. The end result? A stronger heartbeat. Let's take a closer look at a couple of examples. First up, we have digoxin. This Digitalis glycoside is often utilized to treat conditions like heart failure and atrial fibrillation. Its primary action is to strengthen heart muscle contractions, thereby improving overall circulation. Next, we have digitoxin. It's similar to digoxin, but it's primarily used when the oral route is not feasible or when a longer duration of action is required. With this understanding, we can now explore the specific uses and cautions associated with Digitalis glycosides. Digitalis glycosides have a variety of uses, but also come with some important precautions. Let's delve into these. Primarily, Digitalis glycosides are indicated for heart conditions. They're commonly used to treat heart failure and to regulate certain heart rhythms, particularly atrial fibrillation. But they don't play solo in the body. They interact with other drugs. For example, they can enhance the effects of certain heart drugs, like beta blockers, and can be influenced by drugs that affect kidney function, like diuretics. However, not everyone can take these drugs. Contraindications include known hypersensitivity to Digitalis glycosides, ventricular fibrillation, and some types of heart block. Simply put, if you have certain heart conditions or are allergic to the drug, it's a no-go. Now, on to precautions. Digitalis glycosides require careful monitoring. Overdose can occur easily and the signs may not be immediately apparent. Regular blood tests are necessary to ensure the drugs are being used safely. And remember, they're not suitable for everyone. Children, the elderly, and those with kidney problems need special consideration. Also, lifestyle factors can impact how these drugs work. For instance, a diet low in potassium can increase the risk of Digitalis toxicity. So it's not just about taking the medication, but also about managing your overall health. Now that we have a good grasp of these aspects, let's move on to the potential side effects and adverse effects. Like any other drug, Digitalis glycosides have potential side effects and adverse effects. It's also vital to understand their use in pregnancy. Common side effects include nausea, vomiting, and changes in vision. More serious but less frequent are the adverse effects, such as irregular heartbeat, hallucinations, and severe dizziness. In pregnancy, Digitalis glycosides require special consideration. While they may be used if the benefit outweighs the risk, it's crucial to be aware that these drugs cross the placenta and can affect the fetus. Therefore, if you're pregnant or planning to become pregnant, it's essential to discuss this with your healthcare provider before starting or continuing treatment. They can guide you on the best course of action, taking into account your health and the potential risks to your baby. As we wrap up, it's important to remember that while Digitalis glycosides have many benefits, they must be used responsibly and under the guidance of a healthcare professional. We've taken a comprehensive look at Digitalis glycosides, from their pharmacokinetics to potential side effects, We've unraveled how they work in our bodies, their various applications, and potential drug interactions. We've also highlighted the need for caution, especially in certain conditions and during pregnancy. A clear understanding of these aspects is key to their safe and effective use. Thank you for joining us at UMCC Medical Consultant Connector. Like, subscribe, and share for more. Remember, your health matters to us.